More or less. Make I show you where you like it. One body. How we do things, how we party, how we rock it. Make I show you where you like it. How we do things, how we party, how we rock it. Making money every weekend. So me, I know they see them, That know they want. I want to go on this, so go for them. Making money every weekend. So me, I know they see them, Me, I know they look good, You think I know this, you ain't got it. But you know worry, You want the party, no worry, It's only this to carry. If you ever get you, I feel fine. But you know worry, You want the party, no worry, It's only this to carry. That boy, no God, my fine. Marita be like you, Maria. I go tell him Joseph, I'm happy just soon. Marita be like you, Maria. I'm a devotion, when you say shoe. You know, feel like Sha. About the pasta. You know, feel like Sha. About the pasta. I know you know that. Say you know, feel shake. Me, I know money. I know no mathematics. Mathematics, fish, I will no get money. Now, Jack, recipe. Making money. Making money every weekend. So me, I know they see them. That know they want. I want all this up to go for them. Making money every weekend. So me, I know they see them. Me, I know they look good in this. You think I need to wait to move by. But if you worry, You want the body, no worry. It's only big to party. If you ever tell you, I feel fine. But if you worry, You want the body, no worry. It's only big to party.
Jimmy J on the
That is it. Wow. Hey, wow. No one is calling me today. That means our sound is perfect. Woo. Let me see. Yeah. Rachel. Rachel. Chijoke. Share on your WhatsApp. So quickly, as a matter of new policy, I'm going to take the link. Please, if you're watching, take the link and share on your WhatsApp status. I think it gives us a lot of viewership. I have something on my status already. I'm going to delete it. And I'm going to put the link of this talk show. Today, we are talking about adult depression. Everyone, I have shared mine. This is my evidence. I've shared it. We are live together. Yes. So please, if you're watching and if you're happy to do so, quickly take the link of this talk show and share it in your WhatsApp page so that your friends too can learn. Today in the house, we have, oh my God, you know already. Let me see what the family members are saying. Yes, I have shared mine. That is Emife. You see, I pronounce people's name upside down. Forgive me, fam. Forgive me. Emife have shared hers. That's fantastic. Juliet, apologies. I know I owe you, but you know now we'll still meet where we meet. Doctor Boma said, lovely, good evening, family. Fantastic. And another person was, Chijoke. Wow, water is life. I thought I was dying. I drink another. Please, if you have water around you, drink water. Water is life. Today we are talking about water. Blessing Chigozie said, good evening. Uche said, how are you doing, ma? I'm fantastic. Sylvia is dancing. Princess Elizabeth say, I love you, NurseAngel. I love you too. And on that note, I want to say good evening, house. Good evening, family. It's me again, your NurseAngel. your one and only NurseAngel in the house. And I want to inform you that tonight we are talking about depression in adults and older people. I repeat, depression in working age adults and older people. Yes. So in the backstage, we have our consultant psychiatrist. Yes, our global is no longer European. Now he is global consultant psychiatrist, Dr. Prosper Onoha. He's here in the house. Please, can someone give him a shout out? Yes, yes, yes. This is your one and only consultant psychiatrist in the house. In our Mind family, we have the best of the best. No, go around the world and tell me if you can find someone like Prosper Obiora. No way. He is one and only. Let's see what they are saying. Oh, Adebola say, you're welcome, sir. Folami, evening, ma. Let's see, this is my sister. Welcome. That's Yank. Yeah, I can't remember my sweetheart's name. Princess say, I know it's him. You're popular. They already know you. He's a family member now. Obioma said, tonight's topic is very important. Absolutely. And NK said, Chijoke, I see you. All right, this one is tagging. Fantastic. And again, who else will join this talk show? Who else do you think is coming? Can I hear you say, our one and only professor? Yes, yes, yes. The professor that, oh my God, please, if you're there, I said to Professor this evening, I said, Professor, please, can you use simple English? All this, your big, big grammar, we'll be saying yes, yes, but we don't understand you. Unless we go and bring dictionary. I beg, any big English you're throwing to us, break it down. So tonight, we have these two experts, this world class. They're coming to do justice to depression because it's a known fact that depression is a very common illness. Depression is a common illness that has dealt with a lot of us. In fact, globally, it is the highest cause of disability globally. And again, it is also said that 1 in 4 adults, some people will say 1 in 5, 1 in 6, but at least 1 in 4 to 6 adults suffer or will suffer from depression before they die or something. So I want to say that it's an illness that is just close by. It's an illness that is in-house. This is not cancer. I say, oh, it sounds far away. Although now it's coming closer. But there are certain illnesses that is so far away. Like some people may not even know what schizophrenia is. A lot of people may not know what schizophrenia is. But when you talk of depression, it's like a household name. Very common and very, very present in our households with our own partners and sometimes even ourselves. Some of these consultants, you see, also suffer depression. If I'm lying, he will come and say, nay. Some of these consultants and professors, you see, also suffer depression. It's not a, far away illness that we pray is not going to happen to us. It's in the house. So tonight, NurseAngel will just be listening to our professors and consultants. Who else will talk about it perfectly well than themselves? So on that note, I want to, please, if you permit me, let me see what the family members are saying. Yes, Chima Gozigom say you're right, ma. Okay, thank you. Asmua say welcome. Okafor say chai. Yes, it's true. It's that bad. If he goes, said very good topic. And this is our admin say share. Look at our numbers. Please, we need high numbers. Ngozi, this is my elder sister. Oh, her surname has changed. She said, I am here. That is my elder sister. Ngozi, I salute you. My elder sister in the house. And Princess Chamisi, I'm listening. On that note, I want, because we have just 1 hour, we've promised not to exceed 1 hour. On that note, I want to start with our consultant psychiatrist, our global consultant, both European and America and Africa, Asia, worldwide. He's here to talk to us about everything and anything you need to know. Consultant. I want to say that this is the 4th week, the consecutive 4th week. We are talking about depression. We've talked about depression on kids and in children, which you came to talk about. We also got children to come and speak about depression, which they did well. And today, the family said, we must talk about adult depression because it also happens to adults. And consultants, I want to say that we know that some people have a depression is nothing but like a depressed mood, so to say, and more. Yeah, but it starts with a depressed mood and more. Some people, like a lot of things, break up, the bereavement, employment. When you lose your work, you break up from your partner, or something bad happens to you, or you have someone that is sick, a long-term illness. Some people can have depressed mood at that period of time. But in time, as time goes on, it's like rain and storm. It goes away. But there are some people, it does not go away. It remains for weeks, days. It starts with hours, days, weeks. Sometimes it goes to months and sometimes years without even doing anything about it. And we know that there is difference between depressed mood, which I just talked about, that goes away sometimes, and those that linger on, which you can now talk about the clinical depression. I think that is where it comes in. Consultant psychiatrist. If I, NurseAngel, because depression is no respecter of persons, and I'm depressed, and I come to you, consultant, in your clinic or hospital, and you're diagnosing me and you feel I am depressed, what do you have to say to me? Talk to the house using me, NurseAngel, as your patient. Talk to me everything about clinical depression.
Right. Let me just start by saying good evening to everyone. My colleague, Dr. Temitope, nice to have you again. And NurseAngel, I would like to thank you for your kind words and kind introduction. I think you've really dealt with it. You know, you've said a lot of things about this illness. So I think you are an authority in that field as well. But yeah, so let me start by defining what it is. You know, in a layman's term, it's a common mental illness that affects the way we think, the way we feel, and the way we behave. Right? And it is when the normal feeling of sadness goes on and on, you know, that it's, you know, like you rightly said, it could be weeks, it could be months, it could be years. And that is when it progressed from a normal sadness to a disorder. And that is when we call it a depressive illness. About, as you rightly said, 1 in 5 of us, we suffer from this illness at any point in our lifetime. And it is commoner in the female than the male. It is about 2-to-1 ratio. So if we have, let's say, 10 females and 10 men, let's say, if 6 of the females suffer from depression, about 3 of the male will suffer. So it's a ratio of 2-to-1. Right. And this illness arises when there is what we call a chemical imbalance in the brain there's a chemical in the brain, is a neurotransmitter, but to break it to a layman's term, is a chemical that helps to make us feel good when it is in short supply. And this chemical is called serotonin. So when you have less of it in your brain, you are more likely going to suffer from this illness. We don't know who is going to suffer from this illness, but there are certain things that when they are there, it would increase the chances of the person having it, especially when it runs in the family. That's if somebody has parents, either mom or dad, or relatives, uncle, aunties, or even siblings who have suffered from this illness, it increases their chances of having it. There are other causes of this illness, things to do with what I call life events. Life events could be things like bereavements in the family or in the social circle. Family would be when one loses very loved ones. It could be parent dying or sisters or brothers or dying. So it could also increases the chances or predispose the person to having it. The other things would be life events as well, like people going through separation in their marriages, divorce. These are major life events that could push someone into having this. Unemployment is also another, life event. It's called a change in someone's circumstance or this thing. So that would also lead to someone to having depression. Employment as well. I mean, if someone works in a very, you have a very tough, tight shift, long hours at work, when there is no good work-life balance, it leads to someone having this illness. Especially you could see it in people that work long hours, doctors, nurses, firemen, people in emergency service. They get burnt out, and that affects them as well. The other things could be the things that happen in the social circles, and it has to do with maybe when people are being bullied at work as well. There are places you work and it gets bullied as well. Could affect your confidence and your self-esteem, and that would affect the way you feel and the way you think. You start being paranoid, even if there's a little thing you say, these people are against me. Other causes would be things like homelessness, poverty, when you are not sure of where the meal is going to come, you are not able to do things others are doing. You are financially not, anywhere. That could also cause it. The other things would be when you talk about physical ill health, physical ill health like cancers, it's it affects individuals because that is when you have what we call an adjustment. You are trying to adjust to find yourself of having this. People who have chronic pains, it could be waist pain, it could be arthritis, it could be anything. Pain is a terrible thing, and this pain is there every time. It's a huge factor that leads to depression. Other chronic illnesses, like when people have complications of diabetes, it tends to affect them. Well, the other things would be hormonal changes, especially in women when they go through menopause. It is a very challenging time. There are hormonal changes that affects them very well. So some of them would, end up having depression, chronic anxiety that will stay for a very long time. The use of alcohol and drugs, illicit drugs, people think that, it helps them to either sleep or make them feel all right. But in essence, what it does, it's end up depressing their moods. Also, there are what we call the personality type of an individual. There are individuals who are chronically depressed. We don't know why they are, but that is their personality. And it's quite unfortunate. So that happens. Right. So we move on to the symptoms that you get in this illness. The three core ones are low mood. That is when you feel sad all the time and it lasts for a very long time. The second one is loss of interest in things that ordinarily would interest you. That is, you don't have any pleasure, you don't derive any pleasure in those things. So that's called lack of enjoyment. The third one is you get tired easily. Every little thing you're tired. You don't want to do the thing again. You're very tired. That's what we call easy fatigability. Yeah, we're getting tired very easily. Other symptoms are loss of attention and concentration. You're not able to concentrate on anything because you are not able to even think. You don't even have the strength to think. Then you could suffer from poor sleep, poor appetite. There will be weight loss. In some individuals, they actually have huge appetite and they eat more, so it depends on individuals. And then you have people would complain about feeling of hopelessness and worthlessness. That is when it is getting worse now. You start feeling that, oh, I'm worthless, I'm hopeless, there's no hope, I can't see any light at the end of the tunnel. And some individuals would also complain of having suicidal thoughts or having thoughts to harm themselves. That's when we see, in that stage, we now would want to do anything possible to help the individual. Then I know the last time I spoke about children, but in the older adults, in the elderly, they could also complain of restlessness, agitation as well. It is very common in them. And also, there's a common physical problem that comes with the elderly, especially when they have this low mood and, when they feel depressed. It could come as form of a chronic pain. They complain of constant headaches or pains. Some will complain about stomach pains and others, which when you look at it, you don't know where this is coming. It's not as if their heart falls or they have a history of pain and others, but these are signs. And some they get easily irritable. Every small thing get them irritated, and you see them lashing out. This could be so. When you see these changes in the elderly, it could be a sign that you need to go further to explore and ask them about their mood. How are they feeling? Do they have any sense of enjoyment? Do they feel tired easily? So you need to explore more when you see this. It could be pointed that something else is going on, not just ordinary pain. So those are the symptoms that you see. Now, so how, like you asked the question, if I'm seeing you in my clinic, I would have said all these things to you and asked you some questions. Are you having these symptoms? And if they are having, how long have these symptoms gone on? Normally would say these symptoms would have gone on for persistently for 2 weeks or more. So that is when we become concerned and now said, okay, you have this. So the next would be, how do we help you with this? So that will be, how do we manage this? So the management, like I always say, for you to manage a person, you have to also bring the definition of health into it. And that definition means that before you say that a person is healthy, you must be physically, mentally, and socially being able. It's not only when you have headache or when I'm having stomach pain that has been there for a long time, when I have fever, that I said, oh, I'm not well. If you are not mentally well, if you are not happy as you should be, then there's a problem. So in treatments, we do what we call biopsychosocial. Bio means biological treatment. We have psychological treatment, which my colleague is going to talk more about, and then we have social treatment, So myself, I will talk mainly about the biological treatment. And then the social aspect, I could, mention a bit, but my colleague, Dr. Zeb Temitove, will dwell more with the psychological aspect of the treatment. So the biological treatment would mean when after we've advised you on self-help tips, like I always say, self-help tips would be things to be, you have to modify your lifestyle if you're drinking excessive alcohol or using illicit drugs. The advice would be, this is why you're having depression. You need to gradually cut down and stop. And then the other things would be your advice on, your diet, what you eat, and to have good sleep, good rest, good exercise, and also try to check your work-life balance. As I said, if your work is very stressful, you have to look at how to minimize the stress at work. You could take some time off and then try to discuss with the management to see how they make life better, because you have to be alive to work. So the physical treatment, I said, would be the use of antidepressants. What the antidepressant do is to correct the chemical imbalance. Remember, before I started the courses, I said there's a chemical imbalance, there's a shortfall of a chemical called serotonin. So what the antidepressants, what they do is to try to balance up those chemicals in the brain, which in effect try to modulate your mood and try to improve the way you feel and the way you think and the way you behave. So we use antidepressants, and there are so many types of antidepressants. In the older days, we use things like what they call the monoamino oxidase inhibitors. These are things to do, its example of it is no longer being used because of the side effects. And also there are another group called the tricyclic antidepressants. An example of it would be the amitriptyline, nortriptyline, and the clomipramine. They are still in use. They are very good antidepressants, but we have to be very careful, in terms of managing the side effects and other things. But the newer antidepressants we use these days are called the SSRIs. SSRIs means the selective serotonin reuptake inhibitors. We use them these days. They are commonly used because of their low side effects profile. So they don't cause too much side effects. And examples of the SSRIs would be things like sertraline, fluoxetine, paroxetine, citalopram. They are very common in the market, and we use them. And normally we would start treating with a low dose and gradually increase and adjust it as your body demands. So when we start the antidepressant, we try to explain the side effects, the common side effects. The common side effects would be things to do with, maybe you feel a little bit nausea, as if you want to vomit. You could have you could have vomiting, and some would then probably have a bit of a diarrhea. So it could cause headache. But these side effects, they tend to wear off easily as the body gets used to the medication. So it's not to scare you. They're not there all the time. So you use it for about 1 or 2 weeks. The body gets adjusted to it, and it's good. So that is what we use, the antidepressant. At times, if it's not helping, we gradually increase the dose. If it doesn't help, we try to use 2 antidepressants from different classes, trying to augment. We could bring other medication to help stabilize the mood, like the mood stabilizers, So there are so many things we juggle around just to make sure the antidepressant helps. And if it doesn't help, we add other antidepressant and other medications to help. There are some individuals which they have what we call very severe depression. In that sense, they are not eating, they are not drinking, and they feel so worthless and so hopeless that they might want to consider suicide. So in these individuals, what we do when we find out that they are at risk of doing things to themselves, we do what we call electroconvulsive therapy. It's a shock treatment. And what it does, it acts very fast, yes, you know, what it does is to try to reverse those chemicals in the brain and causes an increase in serotonin. But this is only used when the depression is so severe that the person is at risk of doing something serious to their life. That's when we use it. And it is a form of a specialized treatment, and we have to make sure everything is okay before we use it. The person has to be checked out. There are some tests which you have to do. You have to check the liver function test, the kidney function test, and also do an ECG just to see the heart tracing is okay before we do it. So yeah, that is it. And the other thing I was going to say is depression the treatment, the antidepressant, yeah, it could be started by the GPs can start it, your doctors, they can start it. The specialists as well, when they refer you to a psychiatrist, they can also start it. And what we normally do, we start it and then advise that your GP continue, and if there's any need why you should come back and see us, then that would happen. Yeah, I think that this is the physical treatment.
Fantastic. Listen, you have said everything. In fact, people are screaming, wow, thank God I'm here. Thank God I nearly missed today's topic. Oh my God, I don't want to miss it for anything. I'm learning. Listen, house, you're with the best. You are with the best. And what else do you expect? Consultant Prosper, you made mention of ECT, although you did not call it ECT, you called it what it is, the full name. And you said to the house in my hearing, sometimes I'm doing this, I'm calling this, I'm sending this, but I'm hearing you. You said ECT is when a depression is so severe and is an acute form, and the person is at risk. Also, I know you guys look at, even if it's not, they are not at risk of anything and every medication has failed. I know you also consider ACT when
Absolutely.
all medication has failed to work.
Absolutely.
Yeah.
Absolutely. You're right.
I just wanted to make sure I'm in the know. Thank
Yes.
you, consultant. You are the best. There is no other, no one in front. People are behind you. Okay, thank you. I will ask you to mute. Let's go to Professor. Today is lecture. Please, I have my pen and paper and I write in different colors. So if you guys write, don't write. Not tomorrow you say, NurseAngel. No, you have a consultant here. Don't nurse me. Don't nurse me when you have a consultant, please. So, Professor, I would say, please do unmute. Professor, the consultant have spoken. The consultant has spoken. No, you've not unmuted. He has spoken. He has given us, I'm the NurseAngel patient, and he used me to explain everything about depression, ranging from the diagnosis, the causes, the likely causes, the treatment, and what have you. We'll ask him some questions. There are certain things he talked about. Part of it, he said something about that depression could be emotional or physical, a whole lot, environmental, social, la. You can put them into emotional, could be social, psychological, then physical causes. It could be like from pain. And consultant also talked about some chronic pain that they say chronic depression. Okay, it's not here. He talked about the fact that some of them experience something like pain. And the pain, you can't even see. I know pain is not something you see, But there are some people that at least for you to feel pain, there is a cause, there is something, an injury or something. But this is emotional. It's more like anxiety and a whole lot of anxiousness that the more they think, the more they feel pain, their stomach, and they start giving them pain medication. Chronic pain medication like pregabalin and gabapentin and what have you, because they are complaining of pain. So what will you do? Is only the person that knows whether they're in pain or not. And if it's so constant, they have no choice but to start treating emotional kind of pain. Consultant professor, I want to say to you that in line, he's said a lot. I hope he's not mute. He's not frozen. He said a lot about the treatment of depression, medical in terms of medication, kind of treatment of depression. For you, I want you to look at the psychosocial. He tried to separate them, but I'm putting them together because it works hand in hand. So I want you to look at the psychosocial treatment for depression. For instance, apart from medication, we have something like therapies. One very popular therapeutic kind of depression treatment is CBT, cognitive behavioral and therapy. And part of CBT is your thoughts. He talked about the cognition, the thought works in hand with the feeling. If I'm thinking negatively, I will be feeling low, down, sad, and what have you. If my thought, the thoughts and the feeling work hand in hand, and you see it in my actions or what they call behavior. Professor, you see me every time my 32 teeth or 46 teeth or 60 teeth. I'm always laughing, smiling. People are saying, is this real? How can you do that? Is it fake? Is NurseAngel for real? Why are you always smiling? Can't you frown? No, I can't. Someone came to me and said to me, how is it that you smile? Can you teach me how to? He said, a lot of people, they say, I want to smile like you. I want to smile like you. Meanwhile, these people saying it, if you go into conversation with them, they are so negative about, they don't even like themselves enough, and yet they want to smile. One thing I keep saying to them is that the secret or the key is that it is impossible to change your feeling if you don't change your thoughts. That's the cognitive behavioral therapy. You can't, you can't fake smile. And people see me smiling with my heart. They think, oh my God, how can it be real? And if you want them to smile, they will start telling you, I have this issue, that issue, and yet they want to smile. How can that work? Now, because depressed mood, as he said, is people that are low. He said three most important things. Low mood. You see, low, you have to bring it down. Low mood, lack of interest, and easy, he said fatigability or something, meaning you're always low energy, or I can't do this, or I'm tired from doing this, and what have you. If you want to give people coping skills, or better still, using cognitive behavioral therapy to help those that are depressed, because medication sometimes is not all. It is something like when you're acute. Professor said you start first with the self-help, which is like all these coping skill and CBT, and so if it's not working and it's acute, very, very severe, they give medication to lift your mood, then go back to therapy. How will you, from psychosocial part of treatment for depression, treat someone that is depressed, using NurseAngel as your case study?
Okay, thank you very much. It's a pleasure to be here tonight. In our mind, always in my mind. and our destinies are in our hands. It's a privilege. I sincerely appreciate NurseAngel. I want to appreciate my very senior colleague, Professor Chinedu. We're so glad to have you here. The volume of the knowledge you've actually given tonight is not quantifiable. We cannot measure it enough.
It's
And
next to
very
nothing.
true. Yes, and we're sincerely grateful. And again, I've been, to a large extent, been pre-informed that I should avoid possibly big English. So I will. Being mindful of my audience, I'm going to try as much as possible to ensure that you flow along with me tonight. Psychosocial therapy or treatment for depression. Please, let's pick them one after the other. The word psycho simply means the mind. And the simple way to reason it out, the mind is the very location where thoughts originate from. So, and the Englishman wants you to know your thoughts becomes your word. So what you think with time, if you are not guiding it, will always become the things you express. And your words, if you don't manage them well too, defines your character. You cannot separate an individual from his word. So your word is your character. And your character consequently becomes your destiny with time. So these are fundamental. By inference, we will then want to say that if your thoughts can become your word and thereafter become your character, and that defines your behavioral pattern. So when we study all of that, we're studying you, we're studying your behavior. So that is the psychological part now. So it's easy for us to identify your behavior. It's also easy for us to describe and explain your behavior. And it's from there now, we can now look for measures that can help us to modify, to make you socially conform, to make you fit and become healthy even with time. Like I often teach in the class too, the word social simply means human interaction. Human interaction. So every day we interact, and the consequence of our interaction, the effect of our interaction on others and also on the environment also matters. So for tonight, we're looking at the fact that, yes, if you permit me, I want to say it this way. What our professor actually taught tonight is to look at the physiological parameter and see how that can also lead to pathological issues, physiopathological issues. So I'm not looking at how the physiology will degenerate into pathology. Remember, physiology is a technical term used to define how your body functions, the normal body functions. But when it begins to do the wrong things, we call that pathology, abnormal functioning. So for me tonight, I'm not going to be looking at that. I'll be looking at how your behavior can also affect you, and how your behavior can also be used to solve your problem, and how your relationship with others can also help you overcome some specific issues of life. And let's pick them very briefly. If you realize your thoughts at any point in time is not helping you, you think negative things all the time, of course you are not helping yourself. Yes, it's possible there are issues of life, all right? Those issues of life could differ just the way as our eyes, our faces differ from one another. Our problems cannot be the same. That's very true. But regardless of what you're passing through, it is not sufficient for you to think that that is the end of the world, and that that is the reason you should also begin to think of ending the life. Who is saying to you that you cannot rule the world? Who is saying to you that those problems are not temporal? They are very transient. They are, permit me to use another small English here, they are ephemeral. There are things you see for a little and then they will go away, just the way the vapor is. The vapor appears for a little while and vanishes. Okay, that's how problems of life is. It will come and it will go. So you must guide your thoughts. You must be careful what comes into your mind. Like the doctors who want us to know, there's what we call the portal of entry. There are things that lead to your mind. One is your eyes, even your nose, your mouth, even your hair and your skin. All right? These are portals of entry. So be careful what you feed your heart with. They can also help you overcome issues of life. If somebody comes to you and tells you negative stories, it can affect you. So now let's look at it this way. What are the specific psychosocial factors that can affect you? All right? What are the things that your behavior can cause as a problem for you? What are others that you relate with can also, their relationship can lead to a problem in your life? So one, be careful the thoughts of your heart, what you feed your heart with. All right? Be very careful. And very importantly too, be mindful of what others say to you, the kind of friends you keep, the kind of places you go, the kind of things you predispose yourself to. All right? So these are the immediate factors or ingredients or indices or indicators that can affect or result to depression. You already know that depression is that part of your own mind, your mood now, all right, that is going low. Okay? That's what it is. And it's mounting pressure, it's almost threatening your life. So let's come out of it. Like she said, the CBT. Okay? Now, beyond the cognitive behavioral therapy, all right, beyond the emotional, what we call RET, rational emotional therapy to by Elliot, there is the psychodynamics. There are so many of those things. But what all of them are simply saying is, very importantly, identify thoughts that will not help you. Jettison them, throw them away. All right? And what they're also saying is that identify relationships that will not help you. Reduce them, like I do say to friends in the school. Friendship is not by force. It's a matter of choice. If my friendship with you is not adding value to me, friends, I have the right and the liberty to cut the relationship off. I'm not to stay in a relationship that will make me feel bad. That's the psychosocial aspect. You see, the perception of others about you too can affect you because you are not doing the right thing. And you should understand also, do not allow others' perception to also define your personality. All right? Develop healthy behaviors about life. And like one of the instances we had in this program, you must understand that your destiny is in your hand. You have the capacity, you have the propensity, you have the potentials to live a healthy life, to be great in life. All right? Do not be lazy. Don't be docile. Don't be an individual that if others do not feed you, you cannot eat. Be self-productive. Now, very simply, I'm going to pause in the next 30 seconds by asking you just two questions. From all that you are learning on this platform, are you willing to help yourself? become the best you will want to be in life, or you feel that you are a defeated person. Now, your wrong perception of life too can affect you. And that's what Ellis is also saying. And attributing your problems to wrong indices. Even when you know that your problem is because you are lazy, you are not studious, you don't like being productive, and you tend to think your problem is from your family and then it's from your generations. So you should outgrow those things and live a healthy life. Thank you very much, man.
Hey! Wow! You guys have killed it. Look. Thank you very much. You spoke so well, but you spoke in a layman's language as well. And just to round up what Professor is saying, everything you heard him say is this: that in life we have CBT and other therapies. What it looks at is, first of all, the trigger. What is the trigger? He was talking about friends. He was talking about issues in life. There is something else he said. What is not about those triggers? Because he asked the question, are you a victor or are you a victim? He said, are you defeated or can you cope? Apart from the triggers, you have your thoughts, your mindset, your feeling, your behavior. It goes round in circle. I think it, I feel it, I act it. Think it, feel it, act it. This is cognitive behavior therapy. And he now gave you a coping skill, because your thoughts could be so negative, as the consultant said. And this negativity of thoughts makes you so low and depressed. It's either you are in the edge of killing yourself, which Dr. Temitope said, don't. You don't need to. But sometimes, doctor, let's be honest, Professor, it's not just by me saying don't. Some people are so helpless, like Professor can tell you. No matter the coping skill you give to them, they can't do nothing. That is when they give tablets to bring it up, the mood, then continue with the coping skills. I heard him say some of them, that's why they bring ECT. What ECT does is they use shocker. You know, job starter, when your car dies. You see, I'm sorry, I'm relating it to car, but it's not car. When your car dies and it can't move, you push it, which is the coping skill. Push it, which is the coping skill. The car is dead. You don't need to put a job starter. It will, it comes up. Or you keep doing it until it comes up. That is how some physical health, I'm talking about car. Sometimes in physical health, some people's heart stop beating. You can't wake them while you move. Yeah, beat. It stopped moving, it's dead. What they do is to shock it, to bring it back. They use electrical or something to shock it. That is the same way with the mind. Sometimes it's dead in terms of everything is bad. You are like this. Anything they tell you, you can't give those people CBT. It will never work. Never, ever. They are moping at you. They won't eat. You tell them the food is sweet. Take. They are looking at you. They won't eat it. So you use the brain shocker to shock their brain to bring it back. Sometimes they need a full course, 12 courses. Am I correct, Prosper? They need a lot of courses. Then it comes back again. Then we can introduce Professor. Oh yeah, continue to do your thing. It's not easy. It's not easy. Let's admit, you see, depression sounds so, I'm depressed. It is the most abused word in mental health. Depression is the most abused word in mental health and is the most common as well. I don't know how it works. Most abused most common. Most abused, most common. People that don't even have it say they have it. I'm depressed. People that have it say they don't have it. I'm not depressed. So there are some people that get to the extent of, look, it's now time to give up. Prof and consultant psychiatrist, I would like you to talk about suicide. I know suicide is a big topic we'll have to treat separately, but just quickly, because I'm conscious of time now, quickly. There are some people that anything you say to them, you mentioned it in the passing, they want to kill themselves. And Dr. Prosper, a good thing is, although you are abroad, you're a Nigerian, you know, suicide is a terminology Nigerians see as a taboo. In fact, if you have a family that commits suicide, you are gone. That family will be, they will say they committed an abomination. In some countries, including Nigeria, if you commit suicide and succeed, do not succeed and you are alive, they punish you with imprisonment. Someone is calling me. 1 minute. Hello? What happened? Okay. They're reminding me it's time up. So, if you want to commit suicide, if you survive suicide, they punish you. But these people, do you want to talk to us about the fact that even if it's a taboo, it is real. It is, people die. People die of suicide. People die. You know, I remember as a nurse, I know I should ask people, are you suicidal? Hey, oh, you don't ask. No, you're making them to be. That's what Nigerians will say to you. You're making them to be by asking them. Do you want to talk about that? Please. So we'll round up and go. Then consultant, after he talks about that, you just summarize them with dance and go.
Right. So it's like I mentioned, it's part of the symptoms, you know, of some mental health illnesses, you know, not only depression, you could also have suicide in people with bipolar affective disorder. You could also see suicide in people with psychosis. Psychosis, depression, suicide is commoner in depression than most other mental health illnesses. In psychosis, it's also very common because of the symptoms, especially when they have what they call command auditory hallucinations. Command auditory hallucination means when they hear voices telling them to do things. So the voices could come as go and kill yourself. And they have to respond to that voice because the voice, they keep on coming even when they try to resist it. So it keep on coming and become so distressing that they'll say, okay, let me just go and do what this voice say. Now, the thing about it's when suicide is real, it could also, somebody could also end up dying when they don't really mean that they want to kill themselves. And that is what they call death by misadventure. You know, I remember working in a hospital where, because of want of attention, one of the patients went and put a rope, climbed the chair, and was seeking attention from the nurses. I'm going to do this.
EUPD.
Yes, especially those emotionally unstable personality. So they want to do, at times they want to do it to create attention or to seek attention. And in the process, they end up putting their neck there and, you know, before you know it, they've died. They've gone.
No, nobody comes to their rescue.
You know? Nobody comes to their, yes. They don't intend dying. They don't intend doing it. But that is the misadventure there. But in some individuals, they mean it. In fact, it is said that people who died by suicide, if they suffer from mental health problem, 2/3 of them would have seen their doctors a week preceding the suicide. They would have seen their doctor a week preceding the suicide. So they would have gone to hospital to seek attention. So
Sorry.
complain.
I don't want to make you forget your line of thought. Some of them are in hospital, they die.
Yes, yes. Some in hospital. Yeah, they do. Yeah, absolutely. They do. They either get anything. If they get, that's why in the admission in the units now, in the inpatient units where we work and everywhere in Europe, they do it that the wards are free of ligature. You can't see anything. You can't. In fact, even the mattress where they sleep and everything, they make sure that you don't have any instrument that is going to help you to, that someone who is mentally unwell would help that person to either harm themselves or to commit suicide. So it is very serious. They mean it, but again, because of the way the word suicide sounds, when we examine patients or when we do assessment, we come with a warning sign to actually prepare them that we are going to use the word suicide. So we start with, tell me how you're feeling. Do you feel hopeless and worthless? Have you ever felt life not worth living? So these are warning signs that are coming. And if they say yes, you said, okay, have you ever had thought of doing harm to yourself? So that you're preparing them. You don't just jump. Have you thought about suicide? That would be the last, So when you start with, have you thought about life not worth living? And they say yes, then that would encourage you to go further. But if they say no, then you stop at that. But if they say yes, I have thought about life not worth living, then you can go on. Have you thought about doing harm to yourself in any way? Have you contemplated suicide? So that would be that you.
Don't ask them. You're putting it in their head. I
Yeah.
want you to talk about that. Are you putting it in their head by asking?
Yeah.
Consultant, are you putting it in their head by asking them?
No, you are not. You're just making sure that you're trying to assess risk, and it's very, very important. In every mental health illness, risk assessment is very, very important. Because of Dr. Temitope said, the mind and the thoughts. These are very important. These very, very, very important. The mind and the thought is very important. That's why one of the psychiatrists described the illness of the mind as in fact, it is the worst illness you can have, because it affects everything. Everything about you. You can't do anything, So it is very important. So it is very important that we assess risk. It is very important that we take if patients or if people come to us to say that, look, I'm having this type of feeling. I feel life not worth living. I've been thinking about suicide. We have to take it seriously.
Yes.
We have to take it seriously. And to manage it would be to ask the person to seek immediate attention. Go to hospital, go and speak to your doctor, go and speak to people around you, And the one also very important thing is talking is very good.
Ooh.
They say problem shared is almost half solved. It is very important.
Sorry, my mouth is shaking. Listen, CBT is nothing more than talking.
Yes, absolutely.
CBT, copy skill, this one skill, thinking skill, feeling skill. It's talking you through things. And
Yes.
On a quick note, because we are touching on questions that family members were asking. For instance, Chinazam said, is it legal or advisable to get antidepressant without doctor's prescription? No. That they are talking to you about antidepressant does not mean you should go and buy it and use. Absolutely not. Like consultant said, you go first to your doctor. Some GPs or your doctors are allowed to prescribe certain first aid kind of depression medication. But when it's acute, they can't, because that's not their specialty. They have to come to the consultant psychiatrist to do it. So you can't even get it unless you sneak around and sneak around. You can't get it because it's not like a of the counter kind of medication. And I think another family member, our pioneer admin, said, what are the after effects of depression? Does it cause low blood pressure? Just quickly to say, because I'm looking at time now, we should be wrapping up. After effects of depression, depression is low mood. And when you're low in mood, you're always like that, sleeping, this and that. So this alone, if you check your blood pressure, is lowish. It won't be very, very okay-ish. It's going to be a kind of lowish. However, the main cocoa in it is the antidepressant. Some of them can hit down your blood pressure as well. I know consultant is nodding. If I'm wrong, please correct me.
Yeah, like I said, like I mentioned, the common side effect would be you feel like you want to vomit, nausea. Some actually vomit. It could cause nausea, vomiting, or diarrhea. Some would have headache. Some would have a stomach upset.
Oh, yes.
And some would also feel a little bit dizzy or drowsy on it. But like I said, these side effects, they tend to wear off as your body gets this. The other common side effects, that people, they feel very shy or to talk about it, is what they call sexual side effects from the antidepressant.
Yes.
So especially the young ones, you start them on that. If they start having any sexual side effect like loss of libido, loss of erection, and all those things, they will stop.
Yes.
They won't come back. They will stop. They won't come back because they are shy to tell you that, oh, I'm not having a full erection and other stuff. So, and I've lost interest in sex and other things. So it is. And it's advised that when you have it, let your doctor know. There are so many antidepressants we can use. They can stop it and change to another antidepressant. They can cut down the dose of it. And if we cut down the dose, it could stop. And it helps you in the other way. Yeah.
So quickly, Nangog, we've already answered your question. And Afu, this one you say you want to run away from home, that's a different topic altogether. Self-medication, we have told you about it. You don't self-medicate for depression. You can do the self-treatment of psychosocial self-help, but not medication of it. No. It's a very serious, it can affect you, and the side effect sometimes could even be worse than the main thing. So they mix and match, check and check, give you they do titration of medication in most cases, up and down and what have you. So you do not self-medicate. You can self-help yourself with some coping skills, but you don't self-medicate. Antidepressant, Princess said, antidepressant here in Nigeria is cruise and money. If you have money and if you can cruise, you have antidepressant. Okay, if that works for you. And this is one of it. And Chijioke said, Dr. Biko, give me mental health certificate, because what we have learned in our Mind Talk show is enough to get a certificate. Consultant psychiatrist, or you begin to prepare a certificate for the hour. So in closing, thank you very much, consultant. The people are asking for more. They're angry with me. They said, let it go on and on, but no, we need to be disciplined. We have to close. If we need to come back again, we'll come back again. Consultant is now a family member, so he will come back again to you guys. I think he loves you and he loves me as well. So, Professor, I will mute you, consultant. Professor, can you just, in closing, you have talked a lot about cognitive behavioral therapy. I got you. Your thoughts, you're telling them how you should understand to be positive, be bold, be victorious. Don't do this with this, don't do that. Again, some of those things you're saying, coping mechanism, is hidden underneath, because it's almost one and the same. Because if you identify all these things in talking, you need to give them the coping skills to overcome it. If you say, don't be negative, how will I, don't go with, what will I do? So in closing quickly, I need you to mention some coping mechanisms that they can use. Not just say, don't do this, don't do that, try not to do this, to believe you can do that. It's easier said than done. Give me a coping skill that they will use to overcome all this advice you're saying to them, so that they can take something home. Please, in closing, unmute yourself.
Thank you very much. In our mind talk show, in our mind, always in my mind.
My mind.
And my destiny is in my hand. Let me quickly say that the most important coping skill is to always be in our mind talk show. Number 2 coping skill.
I agree. Even if it's my dancing, it's copy. Sorry. I have to say this. I'm so conscious of time. Professor, the consultant psychiatry, can you unmute? Please, Professor, 1 minute. Consultant psychiatry. What did I tell you that is even best than treatment? Talk to me. Say the truth. What did I tell you?
Yeah, you said so. You said so. Talking.
No, I said even my dance.
The dance, yeah.
is best than some treatment you can give to them.
Absolutely.
Continue. You were not here when I was discussing with consultant, but you just said it. Come to in our mind. Hello, family. Hello, family. The treatment, prevention of depression is in our mind talk show. Game over. Game changer. Continue. Unmute.
Thank you very much. Thank you very much. The second coping skill is that your destiny is in your hand.
Jesus.
Your hand is synonymous to your heart. Your heart will never deceive you. What your hand can give you is better than what you will beg to get from others. It's a very important coping skill. Your destiny is in your hand. It's not in anybody's hand. Number 2, stay in touch. Please, there is the interpersonal therapy. Learn to have more time with others. Do not isolate yourself. Always see reasons to be among families, among better friends, good friends. It's very important. And please do not forget, one of the important.
Go on. I'm buttressing your facts.
Good. Another important coping skill, very importantly, is try to eat healthy.
Fantastic.
Drink plenty water.
Fantastic.
Sleep well. Let me share something with every one of you.
Drink water.
Yes. All of you in our Mind Talk show, do you know that we think about you all the time? We plan for you all the time. Let me share this idea. 99% of the problems you have, in sincerity, may not be going to hospital.
Yes.
So learn to talk to people about your problems. Okay? It's not all about drug. I remember one important part of drug. You see, if you are too drug dependent, there is a likelihood that you may run foul and have so many systemic related problems. One of them is the hepatorenal syndrome. You can also have liver cirrhosis.
Yes.
You can have so many degenerative tissues affecting your kidney, affecting your liver, because most of those drugs are not 100% metabolized. Okay? But can you begin to reason beyond drug? Friends, be happy. Sing a lot. Dance like NurseAngel. Do you know you can go to a public space and smile? And far beyond that, always tell yourself the truth. Identify what your problem is. Don't pretend about it. Know it as a problem. Face it headlong and help yourself solve the problem. Be more active, be more productive, be more proactive about life. Don't ever think that you need to end your life. No. You are the best And God has made you the best, and you will be the best. Thank you very much.
All right, closing time. Newt, I think Professor Consultant Psychiatrist said he's going to run away quickly. Next time, he will dance with us because consultant, part of your treatment is dancing. Yes, you just heard it now. So we'll say thank you. Please don't go anywhere yet. Make your call. He has a call to do right now. He gave me a sign. Please don't go away because we'll bring you to say bye-bye to the family. They love you. Please don't leave them without saying bye-bye. So I'll put you at the backstage and dance with consultant. Yes. Can you stand up quickly so we'll dance? Doctor. Hey! Wait. Family, this is our treatment, our online treatment for depression. Wait, I don't want this. I want you to shut. I'm activating my AI. You know, agree, follow me. All right. So our online treatment for depression. Let's give it to you now.
Something. Shabby, you know you can make me go low. Softly, shake your jingle. Make I softly shake my jungle. You love to be that surprise. You can see it in my eyes, and I've come to realize it's a fact that I can't deny. Oh my. You can make me lose control. Baby, my kagiri, open the door, show me the way. I say, kirikata, I say, kirikata, baby, kirikata, I say, open the door, show me the way. I say, kirikata, show me the way. Don't be my African lady, my beautiful lady, I could let you know. Your front and behind you, and the sweet for body, in the enter melody, baby. You love to be that surprise. You can see it in my eyes, and I've come to realize it's a fact that I can't deny. Oh my. You can make me lose control. Baby, my kagiri, open the door, show me the way. I say, kirikata, I say, kirikata, baby, kirikata, I say, open the door, show me the way. I say, don't they I define this gang? Hey, everybody look at the gang. That means something gang. I can check for this gang. Just shake that gang.
Wanna see you move that thing, mama. I wanna see you shake that thing, mama. Mother do the man when you rock, mama. I wanna see you rock and dance, mama. Now give me this, so I get money, oh. I know the fake, oh. I like everything when you need, when you're supposed to. You come and dance with
I saw you put it baby, I saw you put it down, show me the way.
Just on the dance floor, introducing Mr. Ellen Sebakasi, the injection master, to show you some simple and complex things. Let's go. Simple, complex, simple, complex, simple. Love today, love tonight, love tonight, love today. Simple, complex, simple.
I saw you put it baby, I saw you put it down, show me the way.
consultant psychiatrist. Yes, we have to close. Thank God you stayed behind. Okay, Dr. Temito. The network kicked him out. So yes, it's finished, sir. We have to close. Consultant. The people are happy. In fact, they are saying they have learned like a doctor. You've given them everything they need to know. What will you say to them in closing?
Well, I think I have to thank them. I thank the audience. I mean, it's not easy to have that, large audience, listening to what we are saying to them. And again, I will borrow from Dr. Temitope, would say that the secret to being happy and being productive, it's listening and tuning into in our minds. So I, I would advise them to continue to tune in, continue to enjoy your fellowship, continue to bring in members and your friends and your family to join. And it is, I think, it's a platform where you learn. It's a platform that you get educated. It's a platform where you get entertained, and it's a platform where you get informed. Thank you very much, and God bless.
Thank you, consultant, for that lovely, sweet words. And Dr. Temitope, what do you have to say in closing?
Thank you very much. In our mind talk show, in my mind, always
in my
in
mind.
our mind, always in my mind. My destiny is in my hand. Please, if there's anything you should never throw away from tonight, be a solution to every issues of life. If you see yourself as the solution, you will realize there is no problem that is sufficient to overcome you. Okay? Think positively, act positively, and spread positive information all the time. Thank you, NurseAngel. Thank you, Prof. Chinedu. Thank you, sponsor. Thank you to all the family members. Merci beaucoup. Au revoir. Bonne nuit.
He is full of knowledge. I can't leave you guys, but I will leave you guys just for a moment. And I say thank you, consultant professor. I know we have not spoken after the last time. We'll talk again behind the scene. And thank you, professor. You guys are the best. Bye-bye. Bye-bye, family. In our mind, always in my mind, your destiny is in your hands. Please use it. Bye-bye.